During this pandemic, one thing that has become greater on the forefront and had, for good reasons, had the stigma reduced significantly has been mental health. People have been struggling because of the pandemic, or their struggles have been amplified by the pandemic. And there are lots of great organizations in the Oakland County area that are helping to support those who are struggling with their mental health or working to improve their mental health. And one of those organizations is the Rose Hill Center. And we're now pleased to be joined by Rochelle Rothwell, the president and CEO of the Rose Hill Center, as well as Laura Mueller, the admissions director at the Rose Hill Center as well. Ladies, thank you for joining us today on the Oakland County MegaCast.
Thank you for having us.
Thank you very much.
Appreciate having you on. So, Rochelle, for those who are not familiar, what is the Rose Hill Center? What services does the center provide to those in our community?
Well, Rose Hill Center is a residential rehab center servicing those with serious mental illness. And we have a variety of programs, our residential program being our primary program, but we have an extended program, transitional living program. We support those that go on to live independently in the community. So it is a wide-ranging program.
So for those that may need your services, how do people qualify for them, or what does your organization need to know about those that may need your services or to be able to qualify to receive services at the Rose Hill Center?
Yeah, we work with adults, and primary diagnoses that we work with would be adults diagnosed with schizophrenia, schizoaffective disorder, bipolar, major depression, and we also do a lot of work with individuals who have been diagnosed with borderline personality disorder and some other personality disorders. And what we find is that sometimes a mental illness becomes so severe that you're not able to manage it without the help of a community. And that's where Rose Hill comes in, is for people who have tried other mental health treatment, such as outpatient, intensive outpatient. A lot of the times, people that I work with have had multiple psychiatric hospitalizations, which is an acute short-term treatment model, and really need long-term treatment. And that's where Rose Hill comes in. Rochelle mentioned the different programs that we have, and that's our program is designed to help residents stabilize, but really manage and find meaning in their life to rehabilitate. And so as far as someone that's looking at services, typically they've, like I've said, have tried many different treatment programs or treatment modalities and realize that they need more intensive treatment, and that's where we become involved. And so we work with people really all over the country to come to our treatment program, um, and to stay with us, like I said, to really manage the illness, um, and find meaning and get to their, I guess, highest level of independence.
And so with that, you mentioned that it's not the same thing you'd get from acute psychiatric services or mental health services that are maybe just for an abbreviated period of time. This seems to be a lot more extensive and a lot more in depth. How long do people usually receive services from the Rose Hill Center? And what really sets that apart from acute services that may not be as effective long term for those who are battling with psychiatric ailments or mental health issues?
Yeah, so acute short term is typically between 3 days, 7 to 10 days, maybe an average stay, and that's for someone who is in crisis that needs immediate help. And the goal of that type of treatment model is to really start the treatment journey. And for some people, after an inpatient hospital, outpatient isn't enough support or services, and that's where an intensive residential program comes in. It really depends on what's going on with the person and how much support they need. However, we do have a continuum of care where someone can come into our residential program and may stay between 6 to 9 months before graduating to a transitional living program where they're living in their own townhouse here on campus for potentially the first time, or since they began struggling with whatever mental health condition that they came with us to receive treatment. And so typically someone would stay minimally about 3 to 4 months with us for intensive treatment and may stay over a year depending on the type of treatment they need and their goals. I think that's a really important piece to think about when you're looking at mental health treatment is that we all need to work on our mental health, and we may need just a tune up with a therapist every week, every other week, once a month. But some people need much more intensive treatment where they're receiving therapy, case management, psychiatry, all in a community setting, and that progress takes time. Unfortunately, mental health isn't something that is managed in a short term, but like those short term programs really set the foundation for long term treatment, learning, stabilization, and mental change.
We're joined by Rochelle Rothwell and Laura Mueller from the Rose Hill Center joining us today on the Oakland County MegaCast. And as you said, there's not any simple fix to any of these mental health issues that somebody may have or to psychiatric issues that somebody may have. And so going into services like this, it's got to be individualized person to person. How does the Rose Hill Center work with the patients, work with their previous medical providers, with the mental health service providers in order to create programs that will be helpful to them long term and in the short term as well, because every single day is a different battle and a different part of the journey.
Oh, yeah. And I'd say it starts with that first call in admissions. And what I say Rose Hill is really where we are best is that we build a team. Mental illness isolates someone so much from their loved ones. We work with people that have a mistrust of services based upon previous experiences. And so building a team where the individual receiving services is the leader and identifies their goals, and then the team, including our admissions department, case managers, therapists, our support staff, our activities department, our nurses, our dietitians, the family, past treatment providers, so that we're talking about what's worked and what hasn't worked, and really building a team of people to support someone, because we know that that's what someone needs, is to have trusted professionals that are working with them to meet their goals.
The added stresses of the pandemic, whether it be loss of work, whether it be social isolation, whether it just be the uncertainty of this pandemic now going on almost 11 months at this point, it certainly doesn't help the mental health crisis that we've already had established in our country long before the pandemic. And the pandemic can't be easy to navigate either for organizations like yours, who do have people coming in for 3-4 months at a time, reacclimating to the outside world, and then others coming in as well. So, Rochelle, how has the Rose Hill Center managed that during the pandemic to be able to safely bring people in, provide them the services that they absolutely need, but in a safe manner for them and for their loved ones and other people in their life as well as they exit back out into everyday life?
Well, I would say it's been incredibly challenging. I think it's been challenging for us as it's been for other organizations. And I always try to take the opportunity to sort of commend the staff that are here at Rose Hill, because it's taken a tremendous amount of creativity to meet the needs of the residents and really support each other. I mean, we're all having our own challenges navigating personally through the pandemic. So I think it's been a lot of creativity. There was a stretch of time that we paused and we did not admit folks as we were trying to make, adjustments to offices and, screening folks, just really keeping the whole campus on lockdown. We did have that pause, but we were able to figure out ways that we could admit folks safely and still manage to meet the needs of those folks that are on campus. Many of our residents part of the program would be to volunteer and work in the greater community. And of course, in a congregate living setting, we've not been able to allow for that. So again, I speak to the staff and the creative ways that they've created programs on campus to allow folks to continue to progress through their journey, and find, victories and progress, in just really creative ways. Work programs that are on campus that are added to what we would normally do. A lot of fun activity programs, even just being able to have, some entertainment where we can still be socially distant but be together. And I think that it's been a really bonding time, honestly, I think, for residents and for staff.
Rochelle, on that, how does that creativity and that ability to re-navigate the way that you provide treatment during the pandemic, how is that going to help provide even more effective services in the post-pandemic world? Because these problems don't go away when COVID-19's gone.
Yeah, I think, I think that, I think it's probably our team that's bonding, together and pulling together. I think that is a group that has found, like I said, these new and creative ways that they're meeting needs of residents. I think we've learned a great deal about new and, just different ways to support the needs of our residents, on campus. I think it also just the stigma. I think even for many of us working in a mental health facility, we might not always talk as easily about the stresses that we're facing. And I think that our group, again, like I say, we've bonded, we've opened to each other, we've found ways to support not only the residents, but also the staff. Many staff, are finding, situations with loved ones that have been sick or have died of COVID-19, maybe loss of work. I think, again, it's just made our community a stronger community of support for each other, and probably has helped us develop a lot more understanding of each other.
Just over the holiday season, the Rose Hill Center participated in the Detroit News' Cheer for Charity drive, and actually did very well, raising over $43,000 for this organization, and ended up winning $20,000 in a prize from the Detroit News for that competition. What led the organization to want to participate in this, and on top of that, how is the Rose Hill Center going to benefit from the prize money that was received from this effort?
Yeah, I think we were just as, we were so thrilled by the opportunity to be invited to participate, but I think we were also a bit blown away by the sheer amount of support that we received. I would say that Rose Hill has many, I think the work that we do speaks to many. So we've been really fortunate to have a lot of donors that have really stepped up to support Rose Hill throughout the years. And those funds actually are going to help to continue to enhance our programs. But a big part of why we have such a large and consistent donor base is simply that we do a good deal of charity care. So we offer scholarships to those who would not be able to afford the cost of Rose Hill or receive the services that they might need. And so, I think the opportunity for us to continue to be more known as a community in, in Southeast Michigan, and for the services that we provide, I think we are happy to get the word out there so that we can continue to raise and garner support for that financial assistance program.
We're joined by Rochelle Rothwell and Laura Mueller from the Rose Hill Center. Just another couple minutes with you before we'll say goodbye here on the Oakland County MegaCast. Laura, for those who may themselves or a loved one or a friend may need the services of Rose Hill, or those that are seeking those services from Rose Hill but looking to potentially receive one of those scholarships that Rochelle just talked about. What do they need to do in order to begin the process of of admitting themselves or their loved one to the Rose Hill Center?
Right. It's as simple as picking up the phone. Our admissions team is ready to answer any questions that you may have. And our goal is, and especially during the pandemic when there is such a great need, is that you will find our team is ready and open with kind ears to listen, and that we are one of the last phone calls that you will need to make. If it is Rose Hill or if it is something else, that we can provide some resources so that everyone is getting mental health treatment. If you wanted to learn, or anyone listening, learn about Rose Hill, our website, rosehillcenter.org, is a wonderful place to get some introductory information. We do have a YouTube channel as well that has tours of our campus, interviews with past residents and their families, so that everyone listening can experience what it is that we do, and see the difference that we make.
Well, Laura, Rochelle, we thank you very much for joining us today. Anything else that you would like to say, or any other information that would be helpful for our audience or other people to know before we say goodbye?
I think recognizing the importance of mental health, it's something that we've known a long time about. COVID has made things worse for a lot of people, but I think it's also the opportunity to make things better, for us to all have the understanding that people that we're working with, we may not know some of the struggles that they have, but kindness, I think, really goes quite a long way when you're working with someone, and that there is effective treatment, that this is not something that you need to suffer alone with. There are people that are ready to help, and this is something that is manageable just like any other condition.
It is a day-by-day process, that is for sure. Rochelle, Laura, thank you very much for being with us today.
Thanks for having
Thanks so
us.
much.